They're the backbone of our healthcare system. While we think of doctors as the ones who keep us healthy, it's really the nurses who provide and direct the care we receive during a hospital stay. In centuries past, nurses were considered to be little more than servants. That started to change in the 1800s with nursing pioneers like Florence Nightingale. Schools of nursing started to appear, and at the start of the 20th century, nurses began to fight for legislation that would set standards for education and registration of nurses. The state of New York was one of the first to implement a licensure law and has continued to be a leader in defining the role of nursing in a changing healthcare environment.
In the 1900s, nursing was a very dependent profession, and it has evolved into a very independent profession. So nursing has evolved from a very simplistic type of profession to a profession where we handle many advanced technologies. We assess patients in order to make sure that they're safe and that they are receiving the type of care that they need. We're in people's homes, we're in the community, we work in governmental organizations, we are, in some places, the head of some federal agencies. So nursing has evolved from a very discrete role to a very advanced role.
Nurses have a significant impact on patient health. Studies show that the number of nurses hospitals have on staff has a direct effect on patient outcomes. The more nurses, the better patients do.
Good nursing care is absolutely paramount to taking care of patients. For instance, if a patient is not turned properly in the course of their hospitalization, they develop bed sores, pneumonia, urinary tract infections, and worst and most lethal are what's known as a DVT, a deep vein thrombosis, which causes pulmonary emboli. Those are the things you get just from being in a hospital, from being sick. We can avoid all of those, shorten length of stay, and overall make it a really good experience for a patient if you have the proper resources.
While the demand for nurses is increasing, the number of RNs has not kept pace. This has created a worldwide shortage of nurses that shows no signs of slowing.
From the perspective of the patient, I think what will happen is that patients will see nurses less. They will be coming and going at the beginning of the shift, at the end of the shift, and in between that, the monitoring will be less. And therefore, the danger for patients is the increase of errors made by unlicensed people who are not educated at the level of the RN. I predict that we will have increasing morbidity and mortality and error rate increase.
The shortage is here, and it's going to be here for a while longer until we can increase the pipeline, get the faculty prepared to teach the new students. So I would offer anyone to really consider nursing as a career. It's personally rewarding, it's financially rewarding, and it's a great profession because you can do almost anything you want to do.
If you get sick, it's nurses who will help you on the road to recovery. No other group has a greater impact on your health. The New York State Nurses Association advocates for nurses' rights and, in turn, better patient care. As the nation's oldest nurses association, NYSNA has played a key role in advancing the nursing profession. In fact, NYSNA first coined the term registered nurse back in 1903. Just as it did back then, today's association supports and enhances the nursing profession.
The mission of the New York State Nurses Association is to advance the practice of the registered professional nurse and to protect the public's health. We do that through nursing practice, nursing education and research, and also through advocacy at both the legislative and regulatory levels, and we also do it through our collective bargaining program.
As a professional association and nurses union, NYSNA provides important resources for its members, such as continuing education, nursing practice expertise, and a voice at the state capitol.
When we negotiate contracts, it's not just about the economic and general welfare of the nurse. It also takes into consideration the people we take care of, the patients in our care, and how we can perform those duties more effectively, more efficiently. Nurses have to recognize the power of their collective. In a hospital, they're the largest number of workers. Nationally, we have a voice that we haven't yet begun to exercise. That's what I'd like to see, nurses coming together, every state, every union, making a difference on a national level.
The New York State Nurses Association plays a very unique role in this state in protecting the practice of nurses and the nursing profession. We do it in a variety of ways. One way that we do it is we represent nurses for purposes of collective bargaining through our union. Another way that the New York State Nurses Association protects the practice of nurses in this state is that we monitor and participate in the governmental process. We attend many state education department and Department of Health meetings in which the practice of nursing is either directly or indirectly being considered. And we testify on these issues. We will send papers saying, this is the way it should be done. We even will answer direct questions from nurses. We will have nurses call in and say, is the employer perhaps asking me to do something that's outside the practice of nursing? If it's something that no one's ever raised a question about, we will explore with the State Board for Nursing as to whether or not this is something that's within the scope of practice of nurses. And we go a little bit beyond that. As the constituent member of the American Nurses Association, we work with the American Nurses Association on policies that we think should be established not just for this state, but for the nation.
The New York State Nurses Association advocates on the national scene through our two national organizations, the American Nurses Association and the National Federation of Nurses. And we've also taken the lead individually as a state on pension reform legislation to help protect the pensions of New York State nurses and actually nurses across the country. We've also have been a very staunch advocate of healthcare reform probably for the past 25 years. So we have had the opportunity to lead at the national level and also to participate at the national level, again, through the American Nurses Association and through the National Federation of Nurses.
This association has worked for nurses for over 100 years. And I truly believe that 100 years from now, we will be there, making sure that nurses get to do what they want to do, which is care for patients. There is a wonderful and exciting future for this association, and I truly believe that we will impact the practice of nursing in this state for hundreds of years to come. We will always do it because that is our mission.
The New York State Nurses Association, advocating for patients, advancing the profession. For more information, visit our website, nysna.org.